Hi guys, and welcome back. In today's video, we're going to talk about the connectedness between rosacea and SIBO, as well as some other gut conditions, so that you can come up with a holistic treatment plan and get your rosacea clear and under control. First, let's talk numbers. About 50% of people with rosacea have SIBO, and people with rosacea are about 13 times more likely to develop SIBO or have a positive SIBO diagnosis, as opposed to somebody who is a random healthy control subject. That's a pretty stark contrast. So it really starts begging the question, is SIBO a root cause for rosacea? And there's actually been some pretty cool studies that have demonstrated that if you identify the people with SIBO and then you give them antibiotics to treat the SIBO, granted simple but nonetheless, to treat the SIBO, a lot of those people with rosacea will see significant clinical benefit and a clearing of their rosacea. So pretty notable. Not only do we have the statistics as far as like rosacea versus healthy controls, but we also have some data that suggests that treating the root cause, treating the SIBO, can lead to symptomatic improvement or cure or reversal for the rosacea itself. But that's not the only theory for rosacea. That's not the only mechanism that we are aware of. There's a lot of other research being done with rosacea, and there's a couple of other key points that I wanted to make note of, especially as it relates to SIBO or is independent from it. So you can see here, I've drawn a rose for rosacea right in the middle. And then I just drew a couple of the biggest hypotheses that I've seen floating around on PubMed or in research articles, of which I'm going to link two really good ones that are pretty recent, 2021. So I'm going to put those in the doobly-doo today. But you can see that there's a couple that are potentially gut-related or gut-mediated, right? So we've got the gut, high incidence of SIBO. Again, about 50%, maybe more, of people who have rosacea have SIBO. There's a higher incidence of inflammatory bowel disease amongst people with SIBO. And of course, we know that a fair amount of people with IBD, particularly Crohn's, have SIBO as well. So there is some overlap between those. There's a higher rate of irritable bowel syndrome amongst people with rosacea, which we know is also very, very correlated with SIBO. The numbers really run the gamut, anywhere from, I think I've seen studies saying 20% and some studies saying 84% of people with IBS have SIBO. So probably a good ballpark would be like 60% as a whole of people with IBS, in fact, have SIBO. Celiac disease is more common amongst people with rosacea as well, and it's noted that it's more common amongst people with Caucasian background or Caucasian ethnicity, and the celiac genes seem to play some role for some people. So I know one of my patients who has celiac disease and rosacea, for example, so that stands true for him. So celiac disease, and of course we know that a lot of celiacs, especially celiacs who don't find 100% symptomatic improvement upon adapting a gluten-free diet, a lot of those people, in fact, have SIBO as a part of their gut squirreliness. So we have a couple of other conditions, all that overlap with SIBO, and then finally, potentially leaky gut, because leaky gut and dysbiosis and any of these conditions here have the potential to feed into some of these other known root causes. So any of these conditions here can create immune dysregulation. Think of it like your immune system is preoccupied. Your immune system is busy trying to deal with the dysbiosis or the SIBO or the H. pylori, which I forgot to put here, but H. pylori is another one. I'll just put HP for short. But it's like your immune system is already taxed trying to deal with the SIBO or trying to deal with the H. pylori or the dysbiosis or whatever. And it doesn't have the wherewithal to keep its shit together and try to manage the ecosystem on the skin. So immune dysregulation or immune imbalance is a big piece of the rosacea story. And there's a lot of research on cytokines and different kinds of adaptive and innate immune cells. And that could be a direct consequence of the gut pathology that's underlying for a lot of these folks with rosacea. Also, on a similar note, all of these conditions, SIBO, IBD, IBS, celiac disease, dysbiosis, H. pylori, leaky gut, have the potential to rev up the immune system in a way that is inherently inflammatory. So you could have immune dysregulation without a profound amount of inflammation, or you can have both. And I wrote down inflammation and or ROS, that stands for reactive oxygen species. So think about that almost like rusting, like it's the chemical process. It's a reactive oxygen species molecule that is floating around doing damage to tissue, versus inflammation in a more broad context that could be from particular inflammatory molecules like reactive oxygen species, or from inflammatory cytokines, which are generated from the immune system. So there's different flavors of inflammation. I know I've mentioned that in other videos, but whether it is inflammation of an immune origin, inflammation of a fatty acid imbalance, or inflammation from reactive oxygen species, inflammation nonetheless seems to play a big role in the pathogenesis of rosacea. And of course, we know that a lot of people with SIBo and celiac disease and dysbiosis and leaky gut have a profound amount of inflammation that their bodies are burdened with. So both of these things could be direct consequences of something happening in the gut, such as SIBo. But again, it could be H. pylori, it could be something else as well. Then if you come over here, I drew these two in blue because I don't think that they're quite as strongly linked with the gut, but theoretically they could be. So you all have heard by this point of leaky gut. Certainly, if not for my videos, certainly the internet has informed you that leaky gut exists. But there's also this concept that when one of the barrier systems opens up, so the gut being one of them, the other barrier systems open up as well. So when you get leaky gut, you're not just getting leaky gut, you're also getting leaky skin, leaky lung barrier, leaky vaginal barrier, and quite possibly leaky blood-brain barrier. All of these barrier systems that are protecting your body from the outside world, or interacting with microbes, or protecting your brain, all of them seem to open and close somewhat in unison. So if you think about the leaky skin hypothesis or the skin inflammation hypothesis, you could have either of those as a consequence of microbial imbalance in the skin, right? You could have an overgrowth of staph or strep or candida or God knows what else growing on the skin, and that could create leaky skin or skin inflammation. Or similarly, leaky gut oftentimes is going to lead to some leaky skin, especially if that's like a weak link in your chain, so to speak, if that's your phenotype. So leaky gut can lead to leaky skin and skin inflammation. And then certainly, who is to say that the inflammation that's churned up as a result of something like SIBo or IBD or H. pylori, who's to say that that inflammation in the gut stays centrally located in the gut? It could certainly cross over and have some inflammatory consequences in the skin. So really, out of all of the hypotheses for rosacea that I have come across, the one and only hypothesis that doesn't make sense from a gut-centric point of view is the local skin dysbiosis. So that's going to have more to do probably with things like what you're putting on your skin, probiotics, exposure to dirt, exposure to sun, etc. So this is going to be a little bit more truly isolated to the skin, as opposed to all of this other stuff that is cooking beneath the surface, and that inflammation and that immune dysregulation and that stress on the body is churning up this inflammation and then manifesting itself as something that we diagnose as rosacea. So certainly I have seen this with my patients as well. I've seen SIBo patients who have rosacea, and then we get them started on a prokinetic or we get them started on antimicrobials, and the rosacea gets significantly better. I have seen patients with rosacea who have IBS. We don't think they have SIBo, but it turns out they have dysbiosis and leaky gut, and we work towards those things, and their rosacea gets significantly better. And like I said, I do have at least the one patient I can think of off the top of my head who does have celiac disease, and he was an example of somebody who found symptomatic relief going gluten-free, but it wasn't the whole story for him. He still had some GERD, he still had some bloating, he still had some food sensitivities, and we had to untangle that stuff and get to the bottom of his root causes, rather than just saying, oh cool, go gluten-free, you're good forever. There's a little bit more to his celiac story than this, and one of his manifestations was rosacea, and that did get significantly better when we worked on his microbiome. So there's a lot of interconnectedness between the skin and the gut. This is just one great example of the gut-skin axis. There is also a gut-skin axis that comes up with things like psoriasis and eczema. If you guys want me to do videos specific to those and how they tie in with gut health or SIBo, drop a comment down below and I'd be happy to add that to my schedule and my recording list. But since rosacea is so highly associated with SIBo, I really felt like this one was worthy of its own video. And as you can see, there's a lot of root causes potentially, but the roots of the roots might stem back to the same thing. The root cause of the inflammation, the root cause of the immune dysregulation, the root cause of the skin inflammation and leaky skin can all tie back to the gut. And I've seen that clinically with a lot of my patients as well. Thank you so much for tuning in, guys. As always, I would love to hear from you in the comments down below. Tell me, do you have rosacea? Do you have SIBo? Do you have both? Have you noticed that treating your gut has resolved your rosacea or made it significantly better? Or are you still kind of scratching your head trying to figure it out? Let me know, have you worked with practitioners? Have they been able to guide you or help you order lab testing? And finally, of course, let me know if you have anything to add. Is there a root cause to rosacea that I left out or that I neglected here? And do you know how it could tie in with SIBo or leaky gut? I'm sure everybody would love to hear about that in the comments down below. And as always, I really hope that this video helps you put together your best treatment plan so that you can get your rosacea under control or in remission and live a happy and healthy life. Thank you so much for tuning in. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.